Good afternoon, everyone, and welcome to the City of Ottawa's virtual town hall meeting. Bon après-midi, tout le monde. Bienvenue. Thank you for joining us today, whether you're calling in with questions related to the city's response to COVID-19, or if you're watching and listening on YouTube, City of Ottawa website, or Rogers Cable 22 et aussi Câble 23 pour la communauté francophone. If you haven't yet and wish to ask a question, please dial 613-233-1979 and enter passcode 601-0568#. These numbers should be at the bottom of your television screen. I want to begin by wishing those members of our Jewish community a happy Passover. And I also want to extend my best wishes to those celebrating Easter this weekend. Normally, this would be a time for many of us to gather with family and friends. However, in these difficult times, this is, of course, not possible. I urge you to instead use technology like video chat or even a phone call to reach out to your loved ones. Je vous encourage de connecter par téléphone ou par...
Please use the phone or video chat.
Hear a quick update from our panelists, followed by your questions and answers. Joining us today on the line are Councillor Keith Eglai, the Chair of the Ottawa Public Health Board, and here at City Council is Steve Kanalakis, City Manager, Dr. Vera Etches, Ottawa's Medical Officer of Health, Anthony DeMonte, General Manager, Emergency and Protective Services, and Chief Peter Slowly, Ottawa Police Service. I'd like to thank our panel members very much and their teams for their leadership for our city during this very challenging time. I'd also like to recognize our city staff from all departments and services who are working hard to continue to bring services to residents and keeping them safe and informed. I especially want to mention the work being done by our staff on the Human Needs Task Force and the Economic Partners Task Force that we established just a few weeks ago. The Human Needs Task Force role is to help the most vulnerable residents in our community and ensure they have access to health care, shelter, and food. The Economic Partners Task Force is meant to provide assistance to small businesses who together make up a significant portion of the city's workforce. Together, these two task forces are vital in ensuring we all weather the storm and can recuperate quickly when this is all over. Ensemble, ces deux groupes sont essentiels.
These two task forces are vital in our struggle to weather the storm and recuperate quickly.
You working in grocery stores, pharmacies, and other essential services. Your work has not gone unnoticed, and I'd like to extend my thanks on behalf of the city for the valuable work that you're doing during this pandemic. Finally, I want to thank our residents. Unquestionably, this is a difficult time for everyone. Sans doute, c'est une période difficile.
It's very difficult for everyone.
Over the last few weeks, the city has had to make several difficult decisions to help protect residents, keep our community safe, and to help stop the spread of COVID-19 right here in our city. Many of you have been respecting the need to practice physical distancing, limiting your trips out of the home to essential ones only, and washing your hands frequently. We will get through this, but we need to do it together. As I mentioned in my remarks at our City Council meeting yesterday, I'm proud of the way we've all come together to work for the benefit of our community. We know residents have a lot of questions and concerns. Nous savons que les résidents ont plusieurs questions. You're calling 311, Ottawa Public Health, or reaching out to your local city councillor for answers. We're here today to help answer some of those questions as well as others you bring forward during this town hall. And we will do our best to get all of your questions in today for the amount of time we have. I now ask Councillor Keith Eglai, Chair of the Ottawa Board of Health, to say a few words. Councillor.
Thank you very much, Mr. Mayor. Good afternoon. Bonjour. Kwe. During these challenging times, I don't think we can express gratitude enough. Thank you to everyone who has been respecting our physical distancing guidelines and who have made a concerted effort to do their part to ensure the safety of others in our community. I especially want to thank the essential workers who are working day in and day out. Their dedication and hard work has not gone unnoticed. They truly are our heroes. On behalf of the Ottawa residents, I thank you. As citizens, the best way to honor our essential workers is by continuing to respect and follow the physical distancing guidelines set out by public health officials. The weather is starting to warm up, and we've had some beautiful days. I know, and I encourage everyone to take in a bit of sunshine. It is, however, incredibly important that we maintain our physical distancing while doing so. On the topic of warmer weather, We are normally asking for help cleaning our parks at this time of the year. However, given the current COVID-19 situation, this will not be taking place. If you or your household wish to initiate a cleanup activity in your own property, please take into consideration the following related guidelines and legislation and enforcement measures. Stay at home and limit the physical interaction to only members of your household. No more than 5 people can gather in one place. Follow self-isolation requirements. If you have traveled recently or are ill, you are to remain inside your home and should not be participating in outside activities where there's a chance you may come in contact with someone. Physical distancing. It is recommended to maintain a distance of 2 meters from those around you at all times. This includes other individuals who may walk by your house and your neighbors who may be on your property, rather. If you live in a multi-unit dwelling, it is recommended that you do not participate in any outdoor cleaning unless you can ensure a distance of 2 meters can be maintained at all times. Individuals over the age of 70 are recommended to self-isolate and should not participate in any outdoor cleaning activities. We want to remind everyone as well to avoid using playgrounds, park equipment, and to refrain from having play dates, parking lot get-togethers, house parties, group barbecues, soccer or basketball games, regardless of how nice the weather is outside. This is an important message, and I would like to highlight some of the ways that Ottawa Public Health is spreading the word in the greater Ottawa community, in addition to the flyer that was just mailed out across the city. OPH is collaborating with multiple partners who work directly with identified priority populations and minority language communities to assess information needs and preferred methods to receive this information. For example, connections have been established with the Ottawa Aboriginal Coalition, and a plan is under development with the Newcomer Health Services Centre. OPH has developed some COVID-related PSAs that are currently being broadcast on Chin Radio until April the 15th. These announcements are translated into multiple languages, as we have done with physical distancing resources. Additional mental health promotion PSAs are also being developed. OPH has been reaching out to organizations that support older adults to determine their information needs, resources, and delivery methods are being adapted based on the feedback that we receive. This includes a web page dedicated to older adults, ottawapublichealth.ca/older adult COVID. With spring celebrations such as Easter, Passover, and Ramadan coming up, this is a time where many of us come together as families and communities in celebration. But to protect those who are vulnerable, we ask you not visit with relatives or friends, and you celebrate with your immediate household. Perhaps instead consider a virtual meal or gathering. It's a great way to remain connected with the added benefit of less dishes to clean up afterwards. Overall, we want to reiterate that responding to this crisis is a communal effort and responsibility. It is the job of everyone in our community to do their part to help ensure the safety of those around us. Together, we can overcome this. Thank you again for your ongoing efforts to keep everyone in Ottawa safe, and please continue to visit ottawapublichealth.ca/coronavirus. Thank you.
Great. Thank you, Councillor Egline. Thank you for your leadership. Steve Kanalakis, City Manager, will now speak.
Thank you, Mayor, and I want to thank everyone for calling in today. Bonjour après-midi tout le monde. The COVID-19 crisis is having a profound impact on our lives, and this town hall is an opportunity to answer your questions and address your biggest concerns. We don't have all the answers, but we're committed to being open and transparent, and I want to assure you that we're doing everything we can to keep Ottawa safe. Nous n'avons pas toutes les réponses, mais nous
We don't have all the answers, but we want to be open and transparent.
in significant action to help flatten the curve to protect our people and our community from the pandemic. And I want to assure you that the city will continue to provide essential services during this unprecedented time, including safe drinking water, waste collection, public transit, traffic management, and other critical services we all depend on, and which allows us to stay home and function. La Ville continuera de fournir
The city will continue to provide essential services during this difficult time.
City staff are hard at work to ensure municipal services continue and that city finances remain stable. We need to ensure business continuity during the crisis. We need to make sure that we have a reserve of employees who are ready to be deployed to deliver essential service roles, and when the time comes, be able to shift gears for a return to normal operations in a phased approach. We are also focused on continuing to provide support to the most vulnerable people in our community. A Human Needs Task Force has been established to work closely with community partners to respond to urgent community needs, including food distribution, long-term care, emergency child care, social services, homelessness, and shelter needs. It's clear that this pandemic will continue to impact every aspect of our daily lives for the foreseeable future, and that's why we're developing longer-term strategies to manage through this crisis and beyond. The city continues to work around the clock to support you and keep our city safe and running. We need you to follow the instructions of Ottawa Public Health and our federal and provincial health authorities to keep everyone safe. We are committed to listening to your concerns and doing everything possible to provide the assistance that people need. I want to take this opportunity to thank our city staff for their incredible work under these challenging circumstances, and I want to thank the people of Ottawa for coming together to support one another in this difficult time. We're in this together, and I want to thank you for being caring citizens and neighbors and for doing your part for the greater good of our entire community. Thank you. Merci beaucoup.
Thank you. Maintenant, Dr. Vera Etches, s'il vous plaît.
Oui, bonjour. Good afternoon, everyone. Merci, Mayor, et les collègues.
Thank you, Mayor. Thank you to our colleagues for having organised this meeting today to answer residents' questions on COVID-19.
The situation is constantly evolving. Today, we have 458 laboratory-confirmed cases of COVID-19. Unfortunately, 13 institutional outbreaks in long-term care homes and retirement homes and hospitals and institutions, and sadly, 9 deaths. These number of people hospitalized continues to grow. We're at 30 people with 12 people in the intensive care unit. And of course, these numbers are just the tip of the iceberg because we are not yet able to offer laboratory testing to everyone who has respiratory symptoms, but we are working towards broadening the testing criteria. The number of undetected infections is exactly why we are asking everyone to do their part, and we thank you for doing that, to remain practicing this physical distancing, staying 2 meters away from others. Yesterday, I provided an update to City Council, and there's some current mathematical modeling that tells us if we continue doing this part, we actually are in the range of being able to manage through the volume of infections that would put pressure on our healthcare system, that the projected demands on intensive care unit beds look like we can manage at this point. And we need to continue to keep that in place, and so what you're doing is very important. It isn't easy asking you to only go out for essential reasons like purchasing groceries and medications, or your daily physical activity is a challenge. We know that people are feeling stressed and overwhelmed, and I want to encourage everyone to find ways to support your mental health at this time. And you know, drinking alcohol is not a healthy way to deal with stress. Rather, take a walk, take a break from the news, cook something that you enjoy, take the time to do what is best for you. And if you are in crisis, please reach out to the supports available to you. There are lists on the Ottawa Public Health website of supports that if you see someone else who's in need, you can recommend that they reach out, and there are services available over distance. Si vous êtes en crise, veuillez contacter les soutiens à votre disposition.
If you're in crisis, please reach out to the supports available to you. There's a list on our webpage at ottawapublichealth.ca, COVID mental health.
That I'll just look forward to the questions.
Great. Merci beaucoup, Doctor. Thank you, Doctor. Next is Anthony Demonte, General Manager of Emergency and Protective Services for the City of Ottawa.
Merci, Monsieur le Maire. The City of Ottawa's Emergency Operations Centre remains in a state of emergency in response to COVID-19. Senior leaders and staff meet regularly to address emerging issues and situations resulting from this crisis. The City of Ottawa is working with Ottawa Public Health, local, provincial, and federal partners to ensure that the health and safety of our residents. All city departments, as well as the Ottawa Police Service and Ottawa Public Health, are engaged in as this crisis continues to evolve. Nous concentrons tous nos efforts.
We're focusing all our efforts on supporting Ottawa residents, especially the most vulnerable among us, and we're continuing to provide essential services and to make sure that health and the safety of our staff is our first priority. The city is working with local, provincial and federal partners to deal with the pandemic, and we have been for some time. All city services, as well as Ottawa Police Services and Public Health, are monitoring the situation as it evolves.
Ottawa continues to provide services to the public and enact measures to reduce the spread of COVID-19 and support Ottawa residents, especially our most vulnerable. It is imperative that residents follow direction from public health experts to help slow the spread and flatten the curve. We need to do everything possible to protect healthcare workers, first responders, and other emergency personnel, and help them help others. As the severity of this crisis grows, the focus for bylaw and regulatory services has shifted from just awareness and education to add enforcement where warranted. Ottawa bylaw officers have been given the ability to enforce new rules under the Ontario Emergency Management and Civil Protection Act related to physical distancing. There has been much media coverage on the closure of parks and stronger enforcement measures that we are taking for physical distancing to protect our residents. Let me assure you that bylaw enforcement officers are addressing instances only of flagrant disregard for the rules under the Emergency Management and Civil Protection Act. We are doing so to protect the public, and we need people to understand that their actions can endanger others. The vast majority of people are listening and acting on public health recommendations to stay home. However, we are at a point where stronger enforcement sometimes is required to protect the public. This is our job and is the expectation of our citizens. We have the finest officers who understand the importance of their work and have discretionary powers to enforce the rules and ensure public safety and public health. We will continue to make decisions and actions based on the professional advice from Dr. Etches and her dedicated team. And finally, our Emergency Operations Centre is also in enhanced operations for the 2020 Spring Frechette. Moving into enhanced operations is a precautionary measure that heightens the ongoing coordination between city departments to ensure preparedness. We continue to remind the public to stay home as much as possible, to practice physical distancing, and to do what you can to protect the health and safety of others in our community. Thank you. Merci.
Merci. And last but not least is our new police chief, Peter Slowly. Chief.
Merci beaucoup, Monsieur Mayor. Bonjour à tous.
Hello, everyone. Thank you.
Ottawa Police Service are aligned directly with the Ottawa Public Health, who's leading the overall response to the pandemic here in Ottawa. Aligned both philosophically and practically, and we're very grateful. I want to thank Dr. Etches again for her amazing leadership, along with the Mayor, the Council, city leadership, staff, and many of you across the city. Our mission is to make sure that we can continue to deliver core policing while we also support the overall pandemic response. I want you to know that our officers are out in the community 24/7, in cars, on bikes, and on foot patrol, maintaining their social distancing and their own personal health while they contribute to the overall community health. We've taken every step possible internally to develop a healthy staffing strategy plan that will ensure we'll be able to maintain our critical capacity to provide policing throughout this COVID-19 response. We've provided our officers with the best personal protection equipment available and continue to take direction and support from our municipal, provincial, and federal partners in this area. Overall, we are seeing a decline in the number of abuse reports and crime reports. The crime report reduction is not unexpected. We've seen that across the world. The abuse reports are concerning because we know it's continuing and potentially increasing. For that reason, we've launched a number of public safety awareness campaigns targeted particularly at women, at young people, and those who are most vulnerable to domestic abuse, child abuse, human trafficking. For those who are in some cases now even more trapped at home and unavailable to get to other services that had helped them in the past. We've had some calls come in, but we encourage neighbors, friends, and family to continue to be very vigilant in this area. Do not hesitate to intervene, and ideally you would contact your local Children's Aid, other not-for-profit agencies, and if necessary, contact us, the police. Our officers are conducting proactive patrols with the shuttered businesses at locations across the city. We're sharing customized crime prevention information with those businesses and private residents so they can better protect themselves. Quite frankly, social disorder, and particularly mental health disorder issues and assistance to those who are suffering from substance abuse or other mental health crises are in our top 10 area of calls for service and the ones that dominate our thinking overnight. But it's not all about policing. We're also witnessing exceptional and kind gestures by members of the community and by our police service members themselves. People are out in community volunteering and doing their best to connect in healthy and safe ways, to provide food and needed services, to help with wayfinding, and just to provide supports in general. We're working daily with our city partners, including Ottawa Public Health, Ottawa Bylaw, and many other agencies under the city umbrella. We're doing our best to provide safety and services during these difficult times. I'm grateful for the hard work of our Ottawa Police Service members, of all the city staff, and of volunteers and private individuals who are heroes in their own right, but will never come to the light necessarily. We're working our very best to provide the best public and policing services we can. In the end, the focus of the Ottawa Police Service is to deliver positive public health outcomes. By doing so, we do our best to improve the community safety and well-being of the million souls in the city of Ottawa. Thank you. Merci beaucoup.
Alors, merci beaucoup, Chief.
Well, thanks very much, Chief.
Time to hear from you, the members of the public. Before we get started, I'd just remind everyone who is going to call in to ask a question, please turn your TV or phone down to mute, the volume on your TV or computer rather, before you ask the questions. Otherwise, there'll be an echo in the call. And if your question has been asked by someone else, please consider asking a different question or let someone else ask a question instead. And as a reminder, we're now accepting calls at 613-233-1979 and enter passcode 601-0568#. That number should be on the bottom of your screen. And we have a combination of individuals who have already written in questions, and we'll take some questions by phone as well. So we'll start with some of the email questions. We've got about, I think, 100 of them, so I don't think we're going to get through to all of them. The first question is, I have some masks, gloves, testing kits, space that I can donate. Who do I inform? Who is going to take that? Is that Tony DeMonte?
I can take that, Mr. Mayor. Very good question. So we set up a donation team here at the City of Ottawa. We've not been overwhelmed, but we've had a tremendous outpouring of support from the community for donations of all sorts. And what we've done is we've set up a donation group here where we can receive that information. So we'd encourage people to call 311, and they will be referred to that team. And what they're doing is they're matching up need in the community groups, etc., all sorts of services that we may have, and the donation you may be able to provide us, whether it's masks, gloves, or other kits, is matched up where the need is. So that is very important, and we thank those who are coming forward with that.
Okay, thank you. Next question is, I'm concerned about overcrowding on buses. What else can we do to improve social distancing? I think maybe our city manager, and I don't know, Vera, if you'd like to offer a comment as well.
Thank you, Mr. Mayor. As we were saying yesterday at the council briefing, our ridership is down about 80%, and so most buses and trains have plenty of room, and I've seen most of them are quite empty, so it's really an opportunity for people to maintain physical distancing. We're encouraging and only allowing people to board by the rear doors and maintain distance from our operators. We're really trying to protect our workforce and not allowing people to enter from the front doors, and we put some protective barriers around our operators to keep them safe, because that's very important to us and also to keep you safe. We encourage you to take a seat by yourself and maintain your distance from other customers, especially around the doors. So that's the advice we're giving you for now. As we start coming out of this, we're going to have to relook at our protocols for public transit, and we'll be having more information, more guidance to our residents. And Dr. Etches, if you have anything you want to add.
Certainly, the reason we use the 2-meter rule to stay away from others as much as you can with that hockey stick length is because the respiratory droplets that carry the virus are heavy droplets that will not be passed on beyond that distance if someone is infected. What we know is that people who are sick should not be out. So if you are sick, you should be home, not using public transit. If you do need to go out to get medical care, we would advise that you use a private vehicle and take precautions if you need to take a taxi to cover your mouth with a scarf or a homemade mask, keep the windows down, and get to health care that way. The other thing that has become clearer is that this is a virus that can be passed on within the period of time before someone really knows that they're very ill. And so that means that the physical distancing is important, and it's also possible that somebody would add another layer of protection by wearing a mask when they're out and they can't keep that distance from others. And so we're talking about here homemade masks, not medical grade masks, which we really need to reserve for our first responders and our healthcare workers. But if people are interested in adding that layer of protection, if they think they can't maintain that distance on a bus, then that is something else that can be done to protect others.
Okay, I think we have a call. If the caller could press *1, and we'll take your call now.
Thank you. Merci. Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question, la première question est de Pat Agnietti from Area 613. Please go ahead. La parole est à vous.
Hello. We are two healthy grandparents, 62 and 69, who have been isolating for the last 4 weeks. We have two grandchildren, 7 and 9, who have also been self-isolating at home with their parents. The parents have been working from home all along, and we would like to provide some support by taking the kids to our home and for a few hours a week and still observe all the precautions. Is this possible after the isolation period we've been?
Doctor?
Thank you. You touch on a lot of subjects there. The challenges of working from home with children running around. The challenge of not being able to gather as a family. The advice is that you limit your contact with people outside of your household. So if you are living with someone already, that person is one of your close contacts. And anytime you come into contact with someone outside your home, even family members, that is an increased risk for transmission of the virus. So unfortunately, every family is going to have to make their own assessment about what's required, what is needed to be able to maintain your mental health and your functioning. But the best advice is to limit those contacts. We do see the most serious illness in people over 70 years of age, and people especially over 80 is where we're seeing the number of deaths. However, we are seeing cases in every age group. So people in their 60s have been in the intensive care unit. And we just want to protect everyone through this period of time. The more we can keep this up, the better the chances of us getting through this more quickly. And so that's my best advice right now. I hope that helps address your questions.
Thank you. The next question is from Benjamin Franz. La question suivante est de Benjamin Franz from GL. Please go ahead. La parole est à vous.
Hi, I appreciate everything that Ottawa is doing and sending a strong message to Ottawans to maintain physical distance. I just want to say that it seems to me like even though we're getting squeezed, and it seems to me like we should be getting more space, outdoor spaces, rather than less. And given traffic is and should be reduced anyways, would you consider closing some downtown roads, parkways, allowing for space for the large amounts of downtown residents to move places without getting squeezed onto crowded sidewalks?
Yeah, thank you for the question. I'll may ask Tony to offer other comment. It's being looked at on a case-by-case basis, and an example is, for instance, Councillor Leeper in Kitchissippi Ward worked with staff and put together a proposal that is going to close off for local traffic only a section of Byron Avenue. I believe that's going to take place in the next day or two. So individual councillors all have a traffic calming budget of $50,000, and they can work with our staff to ensure that whatever road they choose is the most appropriate. Some roads are considered emergency routes and others are bus routes, so it would be very difficult to take away a lane of traffic. But Councillor Leeper has found a way that he can actually work with staff in a collaborative fashion for the benefit of his constituents, and those options are available to all members of council. Tony, I don't know if you had anything else to add, because there are certain restrictions. You can't close certain roads.
Yeah, Mayor, I think it's a good question, and certainly as this continues on, it's becoming more and more difficult to be self-isolated and be able to get outside and walk around in certain areas of the city. But as the Mayor indicated, the bigger challenges that we have is some roads just for emergency services and for other operations and transit become difficult. That said, as the Mayor indicated, we're starting to explore and taking staff perhaps off other work to look at that, because it's complex. The engineers have to analyze routes, have to look at turning radiuses, and have to ensure that emergency vehicles like fire trucks, for instance, can still get through. So it is being explored on a case-by-case basis, and it's something that we're looking at, but it's often very problematic.
So we'll take one of our questions from email now for Chief Slowly. What protective measures are given to police officers to ensure their personal safety?
Thank you, Mayor. We take the personal safety of our officers very seriously, not only because they're an essential service provider. Like everybody, they're worried about what they may contract in their work environment and take home. Many of them have young people and older people in their families that are challenged with health. We've had a great level of cooperation also and support from our different unions as we've worked through this. The officers themselves are issued with gas masks, which are one of the best protections overall for droplet-borne and other transmissible viruses. They use that, although it is not optimal for them. Certainly it's a problem for the public to see our officers dressed up that way. We recognize it's also difficult for the officers to work in that environment, but that is their primary piece of personal protection equipment. They are also issued with surgical masks, and some, because of their working conditions, are using N95 masks. They're all taught, as we all are, around social distancing, even when they're not using their personal protection equipment. We've set up decontamination centers in our stations and facilities to allow the officers who are coming into direct and significant contact to have a full decontamination from their vehicles to their clothing, their equipment, and able to go home safely. It's a constant effort, and we are constantly learning, and we are constantly getting updated from people like Dr. Etches and others around how to manage these circumstances. But our people are coming to work. They're prepared to go out in the most difficult circumstances and provide the best services possible in order to keep themselves healthy and safe, and the city healthy and safe. Thank you, Mayor.
Great. Thank you. Merci. We'll take another call. Again, the phone number is 613-233-1979. And the passcode is 6010568#. And if you could press *1. So I think Eric, our Bell colleague, is going to bring us our next caller.
Thank you. La question suivante. The next question is from Mick Ornoni from Ottawa. Please go ahead. La parole est à vous.
Yes, hello there.
Hello. Go ahead. Hi, Mick.
Hi, I have two questions. First of all, thank you very much for doing this. This is, we're inundated day and night with, let's be honest, a sad, negative information, and we're trying to get, the best we can on a national screen. But I'm glad we're finally doing an Ottawa town hall that's really touching us now personally. I have two questions, and my first question, I don't know who's going to take this question, but I'll do it this way. People are walking and some people are jogging and people going to grocery shopping. And we know how, Dr. Etches feels about sports and parks and everything being locked down. Is there any way, Mayor Watson, of all the sports, tennis is one where there's social distancing. There's only two people. The courts are fenced in. We check mark everything that's there. Tennis balls can be played by one boy and another three by another boy, and it's really just to get out and get some fresh air. And it's the only sport that there's no contact. There's no, you know what I mean? It's like boxing at 90 feet without touching the other person. And I'm just wondering if there's some consideration on maybe opening a special license, a special permit that we can pay to play 45 minutes with a child who needs, of all the sports. I just want to see your mindset where you are on my comment on this question.
Sure. Well, why don't we ask Dr. Etches to comment on that?
I really hear in your voice the desire to be physically active and be able to engage in these kinds of activities, specifically tennis you're asking about. And I appreciate that. I really appreciate physical activity is really important for our mental health, and we need to be able to keep being active outdoors to get through this. Unfortunately, it is confusing when some things are allowed and some things aren't. And so I want to point to what is clearly in place, which is a provincial order from the Government of Ontario that parks are closed, so the infrastructure of all kinds, including tennis courts, is not to be used. So the play structures are off limits. The benches, all of the things that could be contaminated with respiratory secretions. It's to protect people from coming in contact with the virus, because it could be there. People have the infection, they're spreading it without knowing it, and we need to really make sure that we protect people from infection and from the more serious outcomes of hospitalization and even death. It is hard to hear that, and so I guess I encourage people perhaps to explore new things for new physical activity. In the home, there are different videos. People are creating new exercise regimes that they're sharing for free on the internet, and then outdoors, things that allow you to keep moving along, not gathering in one place. These things are what we have to stick to for now.
Okay.
Second question, if I may.
Sorry, Mick, unfortunately, we only have time for one question per person because we're really backed up, but I know you can appreciate that. So we have another question on from email. What financial resources are available? Because as you know, we saw the unemployment figures today. We're doing not as bad as many other parts of the country, but we lost thousands of jobs here in Ottawa, and people are stretched. So Steve Kanelakis, can you give us an update on what kind of financial resources to help people in this time of need are available at the municipal level? Because I know there are a number of programs federally in particular and provincially.
Thank you, Mayor Watson. Under Mayor Watson's leadership and council, they moved quickly several council meetings ago to recognize that many of our residents will require relief, because we saw the impact that this was having in our community, on our residents and our businesses, and council unanimously moved to support and provide financial resources within our own ability at the municipal level. And I'd just like to remind callers that if they go to ottawa.ca/COVID-19, you'll find a section called Resources for Businesses, which has a variety of information relief for business owners from the city, provincial, and federal government. So that's a great resource for you. There's also information on our website, ottawa.ca, about city tax deferrals and rental adjustments. For instance, we've given a grace period for 2020 interim tax, property taxes. All property owners receive a 2020 interim tax bill penalty-free payment grace period until April 15th, 2020. So if you haven't paid your taxes, you have till April 15th, 2020 with no penalties. We also have council introduced a 2020 property tax hardship deferral program. So anybody that has a residence or commercial property with an assessed value up to $7.5 million can apply to defer payment of your 2020 property taxes to October 31st, 2020. We also have a property tax and water utility deferral programs. We have deferral programs to assist low-income seniors and persons with disabilities. We've also offered a program to assist eligible farm property owners by deferring the June 2020 final tax installment to December of this year. And we've also provided rental adjustments for businesses renting space within the closed city facilities. And this adjustment will reflect the amount of time the facilities remain closed. Thank you, Mr. Mayor.
Okay, thank you. Eric, we'll go back to our next call. I think if you push star 1.
Thank you. La question suivante. The next question is from Nick Kokomali from Ottawa. Please go ahead. La parole est à vous.
Oh, yeah. Hi, Mr. Mayor and everyone there, and thanks for everything you're doing for us. I know it's not an easy job for you either. My question runs a bit towards the last caller about physical exercise and distancing. I live very close to the Rideau Canal, so unfortunately this question may apply more to the NCC than you, but maybe you can pass the word to the right people. I like to exercise by moving up and down the pathway by the canal, and I go very early in the morning, and I find that the people that are running and cycling do not keep the right distance. And there was a study released earlier this week by the University of Leuven and Eindhoven in Belgium and Holland about the increased danger from respiratory secretions when you are running or cycling, because you're actually running into the cloud left by the person in front of you. So my question is this: is there a way that we can get a message to the people that are running and cycling on the canal to keep that distance? Because the cyclists go whipping right next to you, and about 10% of the runners do not keep the right distance. And I will just end by saying I noticed at Vancouver they've put large pixel board signs on their recreation paths encouraging people to keep the distance. And in Toronto, they actually have people walking around, sorry, not with hockey sticks, but with hula hoops held out at arm's length to encourage people and show them the proper distance. Sorry for such a long question. I hope you can do something to help. Thanks.
Yeah, I'll ask Dr. Etches to offer a comment. I think that's a very good idea. I saw the same study a couple days ago, and I can certainly raise it with the NCC because, as you know, those pathways are their property, but I think it's a great idea that we have some kind of signage along that talks about physical distancing. So, Dr. Etches, would you like to add something else? But we'll follow up. A member of my staff will contact the NCC. If we can help them get some signs up, we'd be happy to do it as quickly as possible.
Yes, I agree. It's important that everyone understands exactly what we're asking. You can always direct people to the Ottawa Public Health website, which has a lot more detail about what we mean by physical distancing. And so maybe if I appreciate, I think they are good suggestions. If there's further questions around the risk of running, causing exposure to the virus. I think I had a question this morning about whether people should clean their running shoes after they're outside. I think I just want to remind people, go back to you have to come in contact with somebody's respiratory secretions to be able to be infected. So you need to have some snot or some spit that enters into your body, usually by unclean hands. So if your hands aren't washed, then you touch your eyes or your nose or your mouth. Those are the most common ways that the virus will enter. And we need then to remind everyone those basics are really still important. When you're out and you come back in, wash your hands, avoid touching your eyes and nose and mouth until your hands are clean.
Great. Thank you very much. Our next caller, Eric, if you could let us know who's calling, please. Et si des questions en français aussi.
La question suivante. The next question is from Catherine Gardner from Nepean Bell Corners. La parole est à vous. Please go ahead.
Hello, and thank you for taking my call. My question is about support workers going from home to home wearing their street clothes. So they don't have gowns on when they're going from client to client. And I'm just wondering how that can be changed so that we are carrying the virus from one home to the other. Also on hand washing, I'm seeing videos on hand washing, but I never see the video showing how to turn off the taps. Even today I saw on the news where somebody was washing their hands and then touched the taps. You're touching a dirty tap, which you have just washed your hands with. So I'm just wondering whether something can be done with those two purposes. Thank you for taking my call.
Thanks. Two very good points. Dr. Etches, please.
The healthcare sector is organized in an emergency response mode right now, and that means that all aspects of the healthcare sector, not just hospitals, but long-term care homes, retirement homes, the home care services that I think you're referring to, the personal support worker staff, everyone is looking at what is the appropriate level of precaution to take in those different environments. And so I am in contact with the healthcare sector leaders to discuss items like this, what kind of protection is needed. So there are, precautions that are taken when somebody has a respiratory illness. Then there are droplet precautions that we recommend. So people would put on a gown over their street clothes. People would use a mask and eye protection. So these are the kinds of things that we want to do routinely when there's someone looking after somebody else who has respiratory infections, and we're continuously looking at updating the guidance for people given that COVID-19 is here. Hand washing, you're right, you think it's the basics, but it's always good to remind people exactly how, and that's why I encourage people to share videos, to look on websites, and you're right, you need to make sure that you don't recontaminate your hands after you've just washed them. So I agree with your observation, and we'll continue to promote that kind of messaging.
I think Catherine's point was, is there a suggestion you have, maybe a Kleenex or a towel?
Oh, so yes, right now I can practically speaking say once your hands are clean and you need to turn off the tap, if you have the kind of tap you can use your elbow to try to get the tap off, or if you need to turn it, then we recommend that people use a paper towel or something else that's nearby to be able to turn off the tap without touching it with your hand.
Okay, thank you. We have another email question. These have been sent to the city over the last week, mostly through 311. We're coming up to farmers market season, and can farmers markets still open? Tony.
Yes, Mayor. So markets have been deemed essential by the province, and the city's been working with Ottawa Public Health and have established guidelines for the farmers markets, operating whether on public or private property. These guidelines aim to advise organizers of what we're all talking about, various physical distancing, cleaning measures, etc. But markets are also encouraged to leverage the online platforms as a means to sell their products, and we're seeing many suppliers moving towards that service delivery model, so it's something to be encouraged.
We have a lot of great farmers markets all over the city. We have another call. Eric, if you'd like to introduce our next caller, please.
Thank you. La question suivante. The next question is from Patricia Stonehouse from Carlton Heights. Please go ahead. La parole est à vous.
Hi, good morning. My question is in three parts. The first is dealing with the living, and the second is regarding the seriously ill, and the third is regarding the deceased. Given the current 2-week delay in delivering groceries, has any consideration been given to assigning one inactive school bus per grocery store to increase the effectiveness of deliveries? And in consideration of the very sick, have the tragic event response and emergency crisis management teams from Carleton University and Algonquin College been asked to prepare their resident dorms as just in case more beds might be needed? And finally, given the projected number of victims to COVID-19, have lumber stores, kitchen and bath companies, wood patio builders, for example, been specifically requested to retool for coffins and pine boxes?
Okay, so on the delivery service, I'm not sure if anyone has a comment on that, because they're run obviously by the private sector, and I think they've been overwhelmed, as you pointed out. It's taking some time. I know there was one new service that I tweeted about. I can't recall. It was something grocery. That's a service that's allowing people to go and get help on groceries. Does anyone else have anything on delivery, Dr. Etches or Tony or Steve?
I don't know specifically what service you're talking about, but I know the City of Ottawa has a human needs task force that is helping isolated people who are having difficulty be able to access essentials like food. So there is a volunteer network that's possibly able to help in those kinds of circumstances where other help isn't available if you contact the city 311. Otherwise, the questions were related to needing extra kinds of beds or hospital beds or alternatives to hospital beds to care for people who are seriously ill. I can tell you that, again, the healthcare sector working collectively across our region is looking at how, and they've already increased the number of beds they have available for intensive care, and they're doing that through their traditional sites, and they're looking at if more is needed, what extra non-hospital sites could we use. So if people have ideas, they're welcome to pass those in. But I think what I wanted to say, and it relates to the last point, we don't need to be building extra coffins right now because we see people doing the right thing. We're physically distancing and we're keeping the number of infections manageable for our healthcare system. And likewise, we're keeping the number of deaths down. And so it's good and we appreciate that. Of course, the situation evolves and we want to be prepared. So people are thinking ahead of the worst case scenarios, but this is not something we need to ask people to start to change and produce new products at this moment.
So just to follow up, Patricia, on your first point, we've actually had very generous offers from the Shaw Centre, the EY Centre, and the Canadian Tire Centre if there's a need for additional capacity, as well as a number of hotels. So we do keep a record of all of these potential sites, and you also mentioned a couple of other very good ideas, including the college and university residences, and we've also had a suggested offer from what used to be called the Terry Fox Centre, which has 150-bed capacity near the RCMP stables, which is a youth national youth program that's obviously not operational now because of COVID-19. So thank you for those 3 points, and we'll go back to Eric and our next caller, please. Le prochaine, s'il vous plaît.
Thank you, merci. One more reminder, please press *1 if you have questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. La question suivante est de Bruno Pascal d'Orléans. The next question is from Bruno Pascal from Orleans. Please go ahead, your line is open.
Oui, bonjour, Mayor Watson, bonjour.
Good day, everyone. I have teenagers, and I'm concerned about the social distancing, limiting the number of people to 5. It's very difficult for teenagers to respect that 2-meter distance when they're together. Maybe the number of people should be reduced to 2 people. And secondly, has to do with sidewalks. Sidewalks are not that wide. So I was wondering if we could close up some streets so that we can maintain the social distancing. Thank you. Well, thank you, Bruno. Regarding the number of 5 people, or it's a provincial regulation. The province started with this with 50, as you know, at the beginning, but now it's a provincial regulation that says 5 people. The city can't change that number. Dr. Etches, you want to add something? And the second issue about the sidewalks? Yeah, Mr. Pascal, for the sidewalks, you're raising a good question. Earlier, we had a similar question regarding the closure of streets. We're looking at this possibility in some places. But, you know, we have to maintain some streets open for emergency services, transit services, and also some the fire trucks. It's too much of a security problem if you can't transit through a certain area. What Dr. Etches is saying too is that we have to keep our distance, but it can be a 3-meter distance with a person in front of us or behind us. I know sometimes to pass someone, it's a little more complicated, but there are very few people driving right now, so maybe we can walk in the street to maintain a distance if you have to pass someone.
Question, if you press star 1, and Eric, if you could tell us who's on the line. I apologize to those many people who were not able to get through, and we weren't able to get through to all of your questions, but we'll remind you once again to go to ottawapublichealth.ca or ottawa.ca for a lot of the questions that people have been put into the web, those two websites. So, Eric, please.
Thank you. La question suivante. The next question is from Michael McGowan from Barrhaven. Please go ahead. La parole est à vous.
Hi, thank you very much. My question relates to what's being used in the math behind the models, because the information that came out in the Citizen today showed models that are, it almost looks like they're old, and that they're showing an increase, significant increase in death later this year, which would imply that all of the isolation that we're doing that should be ramping things down noticeably is not actually being that effective.
Dr. Etches, please.
So there are many different models being used. Most of them conclude the most important thing, which is that the more we distance ourselves from others, especially if more than 70% of the interactions we have with other people can be removed, then we are going to be able to manage through this pandemic and give time for our healthcare system to build the capacity needed. Dr. Doug Manuel is one of the scientists behind the work that's been done specifically for Ottawa, and there's more information about that model for Ottawa on our website. And what he likes to say is that these models are like predicting the weather. The closer in time you are to the actual date, going to the end of April, we're very confident in those predictions. Going beyond that, going into what might happen in the many months ahead, we're less confident in those numbers. So what they're based on, the one I just spoke about, is hospitalization rates to date. So they look at, based on the number of people who have been hospitalized so far, what can we expect in terms of hospitalizations into the future? There are other models that look at things based on death, which again is a very severe, unfortunate outcome, but it's one that we wouldn't miss. If people are that ill, then it shows up, and so that's something else that we can use to extrapolate, because most people are not going to die if they're infected with COVID-19. Most people actually are going to be able to manage at home just fine. That tells us, looking back, there's a lot of other cases out there in the community. So that's another way of looking at it. And the final way that we have models helping us is looking at the laboratory confirmed cases. And that, again, is not a perfect system because we're not able to test in large numbers yet. We're working towards that. And so those models based on testing are going to be affected by the testing rates. So again, models are useful for us to assess different approaches, different scenarios. They don't give us always a definitive picture into the future.
Well, thank you all very much. Thank you, Chief Slowly, Dr. Etches, Steve Kanalakis, Anthony DeMonte, Councillor Eglai, who is on the phone. I also want to thank Bell Canada, Rogers, our interpreters, Stephanie from the city, and Patrick and James from my office, and Eric for making sure the calls got through. Alors, un grand merci à tous les membres du panel qui sont ici.
Thank you to all panelists here today. Thank you all for your participation.
Calls. We had a whole stack of calls waiting, and we weren't able to get to it, but hopefully we'll have another opportunity to open up the phone lines for you to ask important questions during this pandemic. So on behalf of all my colleagues on City Council and the Board of Health, the Police Department, our Emergency and Protective Services, and City of Ottawa crews, we thank you for listening and calling in, and we thank all of those who are helping a neighbor, working as an employee at a grocery store, a pharmaceutical store, picking up our garbage and recycling during these difficult times. We're in this together, and we're going to obviously work very hard, as these professionals have proven, to ensure that we minimize the number of deaths in our community, and we send our sympathies to those who have lost a loved one during this pandemic. So thank you very much, merci beaucoup, and have a happy Passover and a very happy Easter for those celebrating those two holidays. Merci beaucoup, à la prochaine.